2 billion people have downloaded this app. So from Microsoft's perspective, this is a potential moneymaker, and it's clearly a huge social media hit. Microsoft says that it would bring all of the data into the United States, and it would also increase a lot of the safeguards that are already on place on TikTok, and they would increase that as well. So Microsoft says that it's going to go above and beyond in terms of trying to protect people's data.
That was Samira Hussein, and a short time ago, President Trump said the US Treasury should receive a cut of Microsoft's deal, should it go ahead, a deal that could be worth tens of billions of dollars.
Without us, I use the expression, it's like the landlord and the tenant, and without the lease, the tenant doesn't have the value. Well, we're sort of, in a certain way, the lease. We make it possible to have this great success. TikTok's a tremendous success, but a big portion of it's in this country.
President Trump there. Meanwhile, the US is nearing 5 million confirmed cases of the coronavirus. There's already been more than 155,000 deaths, and America's National Health Institute is warning there could be another 27,000 people dead with COVID-19 by the end of this month. CNN's Sarah Seidner reports.
Be felt for decades to come.
The head of the World Health Organization predicting the effects of the coronavirus pandemic will last for decades.
Not only on the health aspect, but on social, economic, and political.
The coronavirus is still spreading out of control in parts of the United States, and death tolls are continuing to climb.
We are very concerned, and this is a very serious point, and deaths will continue to increase for the next few weeks.
One reason why? The U.S. is in a new phase, according to the White House's point person on COVID response, Dr. Deborah Birx.
What we're seeing today is different from March and April. It is extraordinarily widespread. It's into the rural as equal urban areas. And to everybody who lives in a rural area, you are not immune or protected from this virus.
The numbers back that up. July's total new cases more than double that of any other previous month. The hotspots mostly flaring up in the South and West. Mississippi, now the highest percentage of positive COVID-19 cases in the country, with a staggering 21% positivity rate. South Carolina follows with 18%, as you see us now, a hurricane threatens its shores. In Florida, the storm's winds forced some testing sites to close for a bit, creating a drop in confirmed cases. Those sites now back open.
We are encouraged by some of the trends we're seeing. We continue to see a downward trend in visits to the emergency department.
Still, Florida is on the verge of hitting 500,000 confirmed coronavirus infections. California, with nearly double Florida's population, has already surpassed that terrible milestone.
Sarah Seidner reporting. And the World Health Organization is warning there may never be a silver bullet to solve this pandemic, referring, of course, to the development of potential vaccines and the lack of certainty that any would be completely effective. The former king of Spain, Juan Carlos, says he's decided to leave the country, weeks after he was linked to an investigation into alleged corruption. He says he will remain available to prosecutors examining his alleged involvement in a Spanish company securing a high-speed rail contract in Saudi Arabia. Juan Carlos made the comments in a letter to his son Philippe, to whom he handed power 6 years ago. Here's the BBC's Nick Beake.
It's interesting trying to interpret this. It is, on the face of it, a letter from a father to a son making clear that the allegations are detracting from the current institution and the way they're trying to rebuild and salvage reputation. He makes it clear that the allegations against him are very public and they're damaging, and he says the best thing is for him to leave the country so that his son is able to govern, to reign in a way that he describes as being tranquil. So that's his hope. Whether or not, of course, that is the case, we shall see.
Nick Beake reporting. The Italian city of Genoa inaugurated its new bridge today, almost 2 years since the collapse of the previous one, with the loss of 43 lives. An investigation into the cause of the disaster is due to be completed shortly, with a trial expected next year. From Genoa, Mark Lowen reports.
An onlooker captured the moment on the 14th of August 2018 when Genoa's Morandi Bridge fell. Opened in 1967, its concrete cable stays were a feat of Italian engineering. But at 11:36 a.m. that day, one broke, bringing down a pylon and a 210-metre section of the bridge.
When I got the news, I was paralyzed.
The renowned architect Renzo Piano, whose work has included the Shard in London and Paris's Pompidou Centre, is from Genoa.
Morandi Bridge was, for me, fantastic, brave example of engineering, beautiful. Everybody loved that bridge. Everybody also was a bit frightened by the fragility of the bridge in some way. Bridge should never collapse. They don't have the right to collapse.
On the bank of the river, beneath the imposing new bridge, is a memorial garden with 43 trees symbolising each life lost. And then on one side, the names are carved. Next to each other, three names. Roberto Robiano, his wife Ercilia Piccinino, and their son Samuele Robiano, just 8 years old, the youngest victim.
This is my brother, Roberto, my nephew Samuele, and my sister-in-law Ercilia.
Roberto's brother, Giorgio, is pointing them out. On that day 2 years ago, he was with his father, waiting to celebrate Roberto's birthday.
The worst thing, it was to tell to my father that his son is dead. I feel my heart like split in two and one part is missing. This new bridge is just made with the blood of my brother, my nephew, and my sister, and under 40 persons that lost their lives, and there's nothing to celebrate.
That report by Mark Lowen in the Italian city of Genoa. Several French cities have made face masks compulsory from today as they try to fight a resurgence of COVID-19. One is the Atlantic town of La Rochelle, usually a favourite destination for tourists. That's where the BBC's Lucy Williamson filed this report.
Bonsoir. Along the edge of La Rochelle's old port, 18-year-olds Maud and Manon patrol the tourist crowd with a clipboard.
Est-ce que vous avez des masques?
They've been sent by the mayor's office to enforce new rules, requiring everyone to wear a face mask in the city's centre streets. They have a ready supply of masks to hand out, and they don't take no for an answer. The new rules have been compulsory here since mid-July. Breaking them now brings a fine. And tourists like Leo Nather, over from Dublin, say it's helped ease anxiety about coming here.
The markets can be very crowded. There's no social distancing in the markets, except that it's very well policed and that everybody is wearing a mask. You feel somewhat protected.
France has been recording more new cases of coronavirus each day than Spain. La Rochelle itself has had very few, but there are currently more than 140 small clusters around the country. Europe's COVID map is local, not national. And Councillor Michel Sabatier says that means national policies can only go so far.
The French government, like any other government across the world, is groping in the dark, let's face it. So it's touch and go, and you can make out from the free-for-all that Europe looks like when it comes to taking the measure of the virus. You know, one does one thing, the other one does another thing, and at the same time. Frankly, they are all doing their best, but there is no formula that one could follow.
The French health minister has given the green light for local authorities to follow La Rochelle's lead and make it mandatory to wear face masks on public streets. Saint-Malo, Orléans and Lille have already announced restrictions.
I think the mask is a barrier. When you're speaking French to somebody and you're a bit rusty, you kind of, the mouth and the face really does make a difference, doesn't it?
And you can still see the shrug, even with a, even with a mask.
Jackie Dean and Tim Snary drove over from Bristol in their camper van. Safety measures all along the route, from the ferry to the campsite in La Rochelle, compared well with the UK, they said.
Lucy Williamson in La Rochelle. And finally, the death of a 12-year-old girl killed by a stray bullet in Sweden has sparked outrage and reignited debates over the country's handling of gang-related violence. The girl was killed in a drive-by shooting next to a petrol station south of Stockholm yesterday. The gunman had apparently been aiming at two rival gang members. The police are investigating but are yet to make any arrests. Incidents involving gangs in Sweden have risen in recent years, and officials have vowed to crack down on violent crime. And that's World Watch for today. I'm Max Toll. Mani?
Thanks, Max. And that's Midday Report, Te Purongo o Te Potutanga, for today, Tuesday, August the 4th. Big mihi to our producers, Denise Garland, Michael Kropp, and our operator, Jonah Edwards. And we'll be back tomorrow with interviews and the latest news from Aotearoa and the world. But for now, from the Midday team, me taki maata, airera.
RNZ News at 1.
Good afternoon, everybody. Before I get into today's COVID briefing, I have had a few questions about the heart that I'm wearing today. So the Heart Foundation are on the forecourt of Parliament today, offering free heart health checks, which I was pleased to be one of the first people they saw this morning. And of course, you're all welcome too. We care about your health as well. You're welcome to go and see them if you wish to. My heart is fine. It's an exception, very low blood pressure. So there you go. Today, before we get into the daily update, I want to talk about some of the things the government is doing to shore up our defences against COVID-19. As you'll be aware, a new campaign was launched at the weekend. The campaign is to remind everybody that constant vigilance is in everybody's best interests. It's a very small price to pay for our ongoing protection from COVID-19. It's a constant refrain that you're going to hear from all of us. It's not a negative campaign, in fact, quite the opposite. It's to serve as a reminder that we have done exceptionally well as a country. We're now the envy of the world, and we've got to keep our pedal to the metal if we're going to lock in those gains. Gains that were made as a direct result of the sacrifices all New Zealanders have made. We see every day from overseas what can happen if we are not constantly on guard against a sense of complacency. If we take our eye off the ball for just a moment, this could get away on us again, and it could happen quickly. So we cannot afford for COVID-19 fatigue to set in. Now, I can understand right now, this might not be at the top of everybody's minds. Lockdown does seem like an awfully long time ago now, and we're getting used to a sense of normality that few other countries around the world are enjoying at the moment. While that demonstrates our collective success and that our systems are working as intended, those systems can be breached in the future, and every link in our chain needs to be strong if we are to stop that from happening. It's why we continue to ask that New Zealanders make small sacrifices. For example, downloading and using the COVID Tracer app and taking the test if the test is offered. Everyone doing their bit lessens the likelihood of us all having to make bigger sacrifices again in the future. Displaying and scanning QR codes is a very small act that we can take in order to help in the fight against COVID-19. So as at the end of yesterday, the number of registered app users stood at 627,900. The number of posters at 82,929, with 31,497 organisations displaying them. The number of manual entries that have been entered into the COVID Tracer app since that functionality was added last week is 30,198, and the number of poster scans has started to increase even more, and it now stands at 1,845,306. This week, I'm going to be making a significant push to get those numbers up further. I'll be working across government departments, local government and businesses across the country, asking them to redouble their efforts to ensure they've got QR posters up in their entranceways and wherever people will see them. So I've asked the Ministry of Education to use their regular bulletins to schools and early learning services to remind them that QR codes should be on display for visitors. A message will go out to State Services Chief Executives via the State Services Commission portal. I'll be talking tomorrow with the Retailers and Hospitality Association, asking them what more they can do to help encourage greater use of the QR code and the Tracer app, and also just to see what they are doing on the ground. I'll be writing to every mayor and council chief executive in the country, asking them to mobilise their economic development units and their business liaison people to get around businesses in their areas to ensure that they've got QR codes on display and to ensure that their own public facilities have QR codes on display. I'm also asking the Ministry of Health to send out reminders to all of those tens of thousands of businesses who have previously asked for QR codes with a reminder that they should still have those on display. The Tracer app gives us information that we otherwise wouldn't have. In the event of an outbreak, it could make an enormous difference. That doesn't mean that we're not pursuing alternative technology. I hope to have more to say about that on Thursday. This week, the Ministry of Health will also be printing posters for GPs to put up in their surgeries to remind them that it is free to take the COVID-19 test. We know that these conversations are taking place daily, but anything we can do to prompt members of the public to ask for a test when they otherwise might not is worthwhile. So finally, before we get an update on today's situation, a quick comment on testing numbers. The trend over the past week has seen a gradual uptick in the number of tests, but it's still not happening fast enough. While testing numbers in our community are on the increase, we want to see higher rates of daily testing. Ideally, every person who has COVID-19 related symptoms should be seeking a test. That'll be complemented by specific surveillance testing in pop-up clinics like the one at Pack and Save in Queenstown today, which by midday had already had 400 people visit it to take a test. So I want to thank all of those staff and those who have come forward as part of our collective efforts to make that happen. We are intending to use those pop-up clinics much more in the coming weeks in order to see our testing numbers increase. So for today's update, Dr. Bloomfield.
Thank you, Minister. Kia ora koutou katoa. Actually, today there are no new cases of COVID-19 to report. So it's now been 95 days since the last case of locally acquired COVID-19 from an unknown source. 5 of our previously reported cases are now considered recovered, so our total number of active cases in New Zealand today is 22, and our total confirmed cases is 1,217, and we will be just reporting that number again today to the World Health Organization. No one who is an active case requires hospital level care. Yesterday our labs processed 1,608 tests, and of those 383 were of swabs taken in managed isolation and quarantine, so the vast majority were taken either in the community or they were of staff working in managed isolation and quarantine facilities or at the border. You might have heard this morning the WHO Director General Dr. Tedros emphasising that while a number of vaccines are looking promising and are in clinical trials, there is no silver bullet for COVID-19, and even once we have a vaccine, it will take time to manufacture and distribute that. The message from the WHO is very clear, and one we have been reiterating. Stopping outbreaks of this virus comes down to basic public health measures and disease control. We are intercepting and isolating cases of COVID-19 at our border, but we need good baseline testing rates amongst people working at the border and also in our wider communities, as the Minister has mentioned, every day, so we can just remain confident there is no community transmission of the virus in New Zealand. A single case outside of managed isolation could infect other people rapidly and turn into a wider outbreak if we are not vigilant and onto it quickly, and we have seen this happen overseas, including not very far away in Victoria. They are not alone in being amongst countries and territories that have previously had COVID-19 under control, but where there has been quite a significant resurgence, and we have worked too hard to let that happen here. There was some research conducted by our all-of-government team, which confirms our view and the reports we've had back from GPs that people are not getting tested if they have symptoms. This was a survey done of 800 New Zealanders in late July, and around around half of those with symptoms decided not to get tested, with 3/4 of those people doing so because they didn't feel they had COVID-19. If you have cold or flu symptoms, please seek advice from Healthline or your GP about getting a test. Ideally, as the Minister has said, everybody with relevant symptoms should be getting a test. If you are recommended to have a test, please have one. The survey did show that the majority of respondents, 65% of adults and 80% of children, stayed home when they were sick until they were completely well, which, as we know, is the right thing to do. Thank you to those people and to all who are doing that, and to just reiterate the importance of everybody who has symptoms staying home until they are well. And finally, we're publishing our action plan on aged residential care, which is addressing the recommendations of the independent review I commissioned into COVID-19 clusters in our ARC facilities. So from New Zealand and international experience, we know the consequences of COVID-19 getting into these facilities can be deadly, and in our own experience, 16 of our 22 COVID-related deaths here occurred among people who are from these settings. So I commissioned this review in April. An excellent team got together, did the review, came up with some recommendations. We have canvassed a response to those from the sector, and we now have this action plan that has been released today. It has a number of specific actions, including the sector working to develop a national outbreak management policy for aged residential care and a pandemic management workbook for aged residential care. And obviously, given where we are in this pandemic globally, we'll be getting onto those very quickly. And I do just want to acknowledge the enormous work that went in among all those working in aged residential care during the earlier outbreak in this country. Yes, we had infections in 6 of our facilities, but that was 6 of over 660 facilities. And the work that went on, both within those that had outbreaks and those that prevented outbreaks, was phenomenal. And I just want to acknowledge all those who were involved there, and all those who were working with older people and disabled people in the community in their own homes through the lockdown period to provide care and support. So progress on that action plan will be updated on the Ministry of Health website as we deliver on those recommendations. Thanks, Minister.
Happy to open up now for questions.
Minister,
Yes.
you talked about Queenstown and those pop-ups. Frankton has been swamped with people this morning. Were you surprised at the number of people signing up to have tests?
No, I mean, I've always suspected that there's a willingness out there for people to have tests. What I guess has become very clear is that going to the GP is still, for some people, a barrier to getting a test. And so we will use pop-up clinics where we need to get our numbers up. We also have an opportunity, and we were just talking about this earlier, to look across the country to areas where numbers may have dropped away, where we just need to give them a little bit of a lift, and we've got the opportunity to use pop-ups there as well.
Why is there no program in place to test bus drivers who are transporting potential COVID cases from airports to managed isolation facilities?
So they will be covered by the staff at the border testing. So that includes everybody working in that chain, from when someone arrives through to when they arrive at an MIQ. We do have a testing program in place for all of those people. The drivers are covered by that. That's continuing to increase. You know, the number of tests that are happening in that chain is continuing to increase. Obviously, like all things related to testing, I'd like to see that moving faster. But there is a program of work happening there.
Any sort of surveillance program for staff at the managed isolation facilities in the regions like Rotorua and Hamilton?
Yes, there is testing of staff working in those facilities as well, and I'm sure Dr. Bloomfield might be able to give you an update on the numbers, but it is happening.
We've had reports of both numbers.
So I don't have the specific numbers, but just to reiterate what the Minister has said, that all the staff working in managed isolation and quarantine, including those who are hotel employees and those who are seconded from across the public and the private sector roles like security are all part of an ongoing surveillance testing program. That's very, very critical workforces, and we're working with their employers to make sure that not only are they encouraged to, but really supported to have the testing, and we will be doing that regularly and rolling out the program.
How frequently is that happening with each staff member? Say if I go to work on a Sunday and then I'm back again there the following Sunday, how frequently do I get checked?
We've sought some specific advice on this, and everyone's finding their way. There's no rule book on it. At the moment, we're aiming to do it every 2 to 3 weeks, but for some of those workforces who may have more frequent contact with the guests, or those working in the quarantine part of those facilities, that may be more frequent.
In the UK at the moment, they've got a new test that they've announced that only takes 90 minutes to get the results back. Is that something that we're looking at?
Yeah, so we're looking at all the different testing technologies, including the serology testing, so that's for the antibodies, and in fact we're doing some antibody testing as part of our follow-up of these, as part of the investigations we're doing of these people who are returning positive tests as they arrive in other countries. So we're testing all their possible close contacts here in New Zealand with the PCR test. They've all come back negative, but we're also now deploying serology testing as part of that to see if these people have got antibodies, so may have been previously infected. That's the first thing. And the second thing is we are still looking at the rapid PCR type testing that is what the UK are using. It is still not as accurate, that would be a good way to describe it, as the full PCR test. And so it would you'd have to think about what is the situation where a 90-minute turnaround but lower accuracy is better than, if we need to, we can get turnaround in a full PCR test within a few hours.
Wouldn't it be better though to have that 90-minute accuracy so you could make sure that that person is effectively quarantined without having 20 hours to wander around and infect other people?
So if we think people are close contacts, then they remain in self-isolation until the result comes back anyway. So it wouldn't change our actual management of the situation. Where it may be useful, so that rapid testing, point of care testing would be, we may be able to have these machines out in more remote parts of the country here, or it may be something depending on the arrangements we have at the airport. Once we start to think about bringing people in possibly under bubble arrangements in the future, it may play a role there. So yes, we're watching the technology. At the moment, there's no particular indication to deploy it.
Sorry, just on what you were saying before, just to clarify, you said that hotel workers, anybody in contact with those in managed isolation, are being tested every 2 weeks?
That's the goal. That isn't quite the numbers yet, okay. But certainly that's what we're aiming for. But in between 2 to 3 weeks.
Why is that a goal? Why is that not a requirement? Don't you have the power as effectively the employer of these people to make them get tested before they're coming to work?
Look, as I've said before, I would like to see the numbers of tests getting up. Of course, if they don't get up, then we'll look at other opportunities to make sure that happens. I think they've just been standing up all of these testing facilities, to make sure that we're testing staff, for example, at the airport. There is a testing station at the airport every day this week to make sure that we're getting those testing numbers up amongst our border staff. I think we need to give them an opportunity to do that. If that doesn't deliver the sort of result, then of course we can explore other options.
Can I just follow up on that? I also want to reiterate that the testing is complementary to the daily symptom checks that every staff member has, and the Minister will have experienced this in visiting one of these facilities, one or more actually, that even going in the door, every staff member every day does a symptom check, temperature check and so on, and if they have any symptoms, of course they don't go to work and they are tested. So the regular surveillance testing is to complement that, and that is to protect both the staff members. Some of them are very keen to actually have that testing because they are interested in ensuring they are keeping their families and communities safe, and others it is a matter of, that each of these facilities has several hundred staff because of those who are employees and then those who are seconded. They're on different shifts, so it's a matter of getting that program in place in a way that captures all of them on a regular basis.
363 or 383, sorry, forgive me, that were done in the managed isolation facilities. Does that include the staff testing, or is that classed as outside the facilities?
That's just the guests who are there having their around day 3 or around day 12 tests.
Just back on the drivers, you said that a program for testing them is in place. So why are they telling us that they haven't been tested and they feel at risk?
Look, very happy to follow that up. They are certainly they are intended to be covered by the testing of staff working at the border.
Some people who have left New Zealand have gotten in touch with us and they've said that they were at the airport leaving the country and after they'd gone through security they rubbed shoulders essentially with people who were arriving in New Zealand, so people who were potentially symptomatic from other countries. And this could be potentially the contact point where these people then contracted the virus and spread it overseas. Is one aware of or two concerned about?
Look, I mean, this is a reality. If you leave New Zealand, you're effectively entering a hot zone, which is the rest of the world. And that the airport is symptomatic of that. You'll be getting on the plane with people who have transited from other parts of the world. That is unavoidable. That is one of the consequences of travelling internationally, and it's one of the reasons why, even if you're only away for a short period of time, you'll be back in 2 weeks of isolation when you get back into the country again, because you will come into contact with people around the rest of the world, including on planes and in airports who potentially have COVID-19.
Try, in sort of Auckland Airport, I guess, we don't try to petition off departures from arrivals. There is a point at which those two people, groups of people mingle.
It's one of the things that we will be looking at if we have a situation where we have a safe zone travel, for example, and I think there's been some comment on that, that they would have to be kept completely separate. But actually, in terms of separating departures and arrivals, bear in mind that some of the arrivals never leave airside. They never come through the border. They're only there in transit. So if you are leaving the country, the reality is you may well be on planes with people who have come from other countries who have not been through isolation, who may well have come from countries where there's a higher rate of COVID-19. That is one of the risks people take when they leave the country.
Are you comfortable with the level of mental health support that is being given to those in the isolation hotels?
Look, one of the first things I did as Minister, as you may recall, if you can remember back 3.5 weeks, was look exactly at this issue. The extra mental health support, mental health support was beefed up as a result of some of that early feedback we got about the level of support people were having in managed isolation and quarantine facilities. I don't know whether the Director General wants to add to that, but I am confident that compared to where we were, say, a month ago, things have improved in that regard.
In the sentencing of one of the women who escaped isolation today, the judge expressed concern that there weren't enough mental health facilities there to pick up what she was going through. So has it changed since then?
Yeah, you may recall, I think that was the day after that I became the Minister of Health, and that was one of the things that we had a discussion about very early on, about making sure that there is mental health support available to everybody in a managed isolation facility. But again, if the Director General wants to add to that.
Well, just a couple of comments, thanks, Minister. First of all, there are health staff on site 24/7, of course, and my sense is, again, having visited facilities, all the staff, not just the health staff, are very committed to looking after the well-being of both mental and physical well-being of the people who are there, and go out of their way to ensure that any support that is required the need for support is identified and then the support is made available. And likewise, I think one of the key reasons we've moved to having the district health boards take over the oversight of the provision of health services into the managed isolation and quarantine in the Auckland region is because they can then draw very directly on any sort of clinical support they need, either for physical issues or for mental health issues.
I understand that you asked for advice on how best to manage nurses working between the DHBs and the isolation hotels. Have you received that advice, and what did it say?
So the latest advice that I have received is that now at Jet Park, which is where the quarantine is taking place, that is a dedicated staffing there, so there are no people working at the Jet Park, which is obviously where we know we have live COVID-19 cases. No people are working there and working in other areas. It's a dedicated staffing. In managed isolation, there's still ongoing discussions about that, about what's reasonable, bearing in mind that some people may only be there for a short period of time if they're coming in to do testing, for example. That's not necessarily where they're going to be working all of the time. So we do have to accept that there will be more staff flowing through those facilities because it's not a full-time role as opposed to at the Jet Park where the quarantine's taking place. So very comfortable about the Jet Park, still in discussions around the rest of the managed isolation. But again, I want to come back to the comment that you will have heard the Director General and I both make. The people who are undertaking these roles are trained professionals. They deal with the use of PPE and protective, measures in their day-to-day work. It is something that they know how to do. They are very vigilant, and certainly my own experience of visiting them early on is one of the first things I did when I became the minister was go and visit these facilities, is that they're taking that very, very seriously.
Just talking about
I'll let you have one follow-up on that.
If a COVID-19 case was picked up in the community, what would happen to that person? Would they have to isolate in their home, or would they be moved to one of these isolation or quarantine hotels?
Our practice at the moment is to move them into isolation, depending on the circumstances. But it does really depend on the nature of the case, on the circumstances there. But the key point, and I'll come back to this every time, is the faster we can contact trace that person, identify all the people they've been into contact with and put those people into isolation, whether it's self-isolation or whatever else, depending on the risk factors, then the less likely we are to see that result in further spread.
Questions about the COVID Tracer app. First, following up on last week, for the case that went to South Korea, was the app ever activated for those locations they had visited in Christchurch prior to leaving?
So my understanding is that it has not been activated as yet for any of the contact tracing. I think we need to see our numbers coming up before we were using the push notifications. But the data from it can be used in the manual contact tracing process that we've got in place at the moment. But certainly, the more people use it, the more useful it will be as a tool, and the more useful that push notification function will become.
Yes. Just going back to what you were saying before about isolating people, is that a change in policy that if we pick up a case outside of the border in New Zealand that we're going to put people in quarantine?
No, I think there haven't actually been any cases, as you can imagine, for about 80 days or so. I think the one example we had was where someone was returned to managed isolation, but I'll get the Director General to comment on that as well.
So what we've done is some work around how we can strengthen our confidence that the isolation is working for people who might be identified as cases in the community. So the mainstay of that will be self-isolation at home, which will be monitored and supported. However, we have and want to make provision for people whose family circumstances mean that they can't necessarily self-isolate at home, and or who might want to reduce the risk to their other family members, that they could use a managed isolation facility. So we've made that provision available as well as part of really supporting people who may be diagnosed and their whānau to actually remain safe. So that provision is there now. And likewise, even earlier on when we had our community outbreak, where we had people who were cases and who, for example, were workers in our aged residential care facilities whose home circumstances didn't allow them to safely self-isolate at home, we made available a place in the managed isolation facility so they could safely do so there.
Have mandatory quarantining planned for cases that pop up in the community?
No, there is no mandatory quarantine at the moment, and no, they wouldn't have to pay for that.
Yeah. I think the operative thing that I said in my earlier answer, if you'll recall, is it depends on the circumstances of the case. So the response is relative to the facts of the case.
Months ago, the government was saying that if businesses didn't put up the QR codes, you might consider making it mandatory. It's now early August. Businesses, in some cases, still aren't putting up the QR code. At what point do you stop asking nicely?
We're not there yet, but look, we'll keep pushing. We'll keep pushing on it.
Can I ask about the report that you mentioned, the aged residential care report? Has that been released before, or is this just?
Yes, the report itself has been released. That was a report done by some reviewers that I commissioned, and they reported back a couple of months ago, and then it went out to the sector for feedback, and this is the action plan in response to that.
Minister, can I just ask a couple of questions about dental care? Almost 2 years on, why have none of the proposals for increasing access to adult dental care been followed up?
Look, I think that was a report that Dr. Clark commissioned fairly early on in his tenure as a minister, in the first year that he was a minister, when you would expect new ministers to be looking at all of the different issues in their portfolios, all of the range of options. There is always a prioritisation process that governments go through. The government made the decision that in last year's budget, Mental health was our big focus for last year's budget, and then of course COVID-19 came along and has been the big focus for us this year. Oral health is something that the government is also concerned about. So of course we have spent some time looking at the different options that exist there in terms of improving oral health outcomes for New Zealanders, and we'll continue to do that. We haven't got any particular commitments to make at this point on that, but it is something that the government has been looking at.
Do you believe that your predecessor dropped the ball?
No, I don't, because as I said, I think within the context of a wide range of different things that a government could spend money on in the health system, oral health is a priority. It is one of those areas where we could spend more money, and that money could be very usefully spent, but so is mental health. And we saw a big investment in mental health last year.
You, as the new minister, follow up on any of those proposals?
Oh, look, we're about to go into a campaign period where, of course, parties will be campaigning on the different things they'd like to do in portfolios, including the Labour Party. It's a little different to advice that the minister may have received a couple of years ago. Of course, we look at all of the areas where the health system can do better.
What about the likes of the recommendation for pregnant women to have easier access to dental care?
Look, that's not something the government has made a decision on, and is not something the government is making any announcements on.
The number of poster scans for RNZ COVID Tracer has gone way up in the past few days since the new update was rolled out. So about 50,000 a day for 4 days straight now, 33,000. And that's more than double what even that spike a few weeks ago when both you and the Prime Minister were arguing for the app. Is that because more people are using it, or was there something in the update that meant that we're now getting more reliable figures than before?
No, I think it is a reflection of the fact that the app is now more useful. One of the biggest pieces of feedback we got from users was that if you can only scan a QR code and you can't add in extra data into it, then it's of limited use. And I think if you saw there's something, like, I gave you the number there, it was about more than 30,000 manual entries. Now that's in less than a week. People have been adding in that extra data. And so I think that shows that it means the app is now more useful to people. It means they can use it to keep a complete record of their contacts and their movements. And the fact that previously you needed to have a QR code and you needed to remember to do it at the time, those were both barriers to people using it. So, we're working not just on pushing messages out, but also getting feedback back in about how we can do a better job of making the app usable.
People are putting those entries in, and that's sort of reminding them later on also when they go to the cafe or whatever to scan.
It's about getting people into the habit of using the app regularly. And I think the more regularly people use it, and I'm one myself, I went through a period of not using it very much, and then I became the Minister of Health, and now I use it all the time. But I think many people will have gotten out of the habit, and we just got to get people back into that habit.
Can I ask you about dental care? How important do you think it is that we increase access to dental care in New Zealand?
Well, I don't have anything to add to what the Minister said. I think he's answered your question comprehensively.
You must have a view on whether we need more access to dental care.
I know if the Minister wants any further advice on it, he will ask me for it and will happily provide it.
All right, we have a couple more questions.
As a Health Minister and Labour Health spokesperson, do you have a response to the Simpson review that you'll be taking to the election?
Yes, we will be taking a more comprehensive response to the Health and Disability Review to the election than the one that you've seen to date.
As a new minister, your view on the headline things like DHB elections, getting rid of those, reducing the number of DHBs, are you able to sort of reveal that to us now? Look,
the government as a whole, and I was a minister in the government before I became Minister of Health, accepted the broad thrust of the Simpson report and the recommendations in it. Of course, there's some detailed work to go through, and of course, the makeup of the government will be part of the response there. So we will put out a Labour Party view before the election, and then exactly what happens, of course, depends on the makeup of the government.
Sign off on the Labour Party view yet?
You'll just have to wait a little bit longer.
But a question, do either of you use or have either of you used TikTok?
No.
Are deportees continuing to arrive here from Australia since that last charter flight we knew about, and are they isolating in the same hotel?
I haven't been notified of any. Of course, that responsibility largely falls to Dr. Woods at the moment, so that's a question you might wish to address to her. But I haven't been notified of any additional flights since the most recent ones that we've spoken about here.
Do you have any updates
All right, last question.
The Roche report from the Contact Tracing Assurance Committee?
Look, we've been working our way through that. I have received the final report, and I hope to release that within the next week or two, the next couple of weeks, so that people can see the result of that report. As I indicated before, though, it did find that the recommendations of the Viral Review have all been implemented, and it came up with some other things that we should be working on, and we are working on those. And so I want to be able to provide an update on those subsequent recommendations at the same time as we release the report, which I hope to do in the next week or two.
4,000 tests a day?
That's certainly what I would like to see. All right, thanks everybody.